I want to give you an introduction to pranayama or breathwork. Rhythmical breathing as well as gentle breath holds which do not cause hypoxia are safe under any circumstances and for everyone, and can be beneficial for you personally, regardless of your circumstances. Intermittent hypoxic training or breath holds is contraindicated in the following cases: acute severe illness, including uncontrolled hypertension, late stages of cancer. It is contraindicated when you have epilepsy. Patients with pacemakers or heart arrhythmias should not do the breath holds. Pregnancy and also post-surgery for up to 6 weeks should not do the breath holds, but can still do the rhythmical breathing. If you are unsure about any condition that you have or whether it is safe to practice this, please do not hesitate to contact us or even contact your healthcare professional and ask them about intermittent hypoxic training. So be available to what the intelligence of your body is. Allow it to guide you into this journey and how far to push it. Because the idea is to push yourself out of your comfort zone, but only you can be the accurate guide as to how far your edge lies. One thing to remember is that the mind will always try to convince you that it is not safe outside of your comfort zone. And dear one, this is not true. It is simply an unfamiliar place outside of your comfort zone, but it is still extremely safe. Intermittent hypoxic training will improve your health gradually if practiced with consistency. The effects might be felt instantly, but long-term your baseline of results may only appear later in your journey. So be open to how it unfolds in your unique story. Expecting instant gratification could lead to the journey being forced and to ripen ahead of its time, and the effects might not be as desirable or necessary. So what if I have a contraindication? You will still benefit enormously in this course. The rhythmical breathing, as proven by HeartMath, is still very beneficial for you and for your health, for your well-being on all levels. The only thing that you're not going to do and going to avoid is the breath holds. The rest of the course is still fully available to you with endless benefits. Let me quickly explain. I mentioned HeartMath Institute. This is a research institute that demonstrates that different patterns of heart activity have different effects on your thoughts and on your behaviors. So for more than 25 years, HeartMath Institute has been researching the heart and the brain connection and learning how these two influences our perceptions, our emotions, our intuition, and also our overall health. So if you want to know more about the HeartMath, please click on the resource link below and you can check out more there. It is extremely important. I want to put an exclaimer here. Do not practice this breathing method while driving in water, while operating heavy machinery. Find a safe space where you can journey within. Because this breath work can be used for, but is not limited to, mitochondrial regeneration and ecstatic optimization. What does this mean? Okay, so it optimizes the function of mitochondria, which is in charge of your energy supply, and so many more vital systems in the body. Like what? Naked awareness. This breath work gives rise to naked awareness and is infused with the work of Dr. Les Femhi on open focus. So what about your cardiac well-being? It improves circulation due to the vasodilation and growth of new blood vessels and new blood cells. So heart coherence is also stimulated and activated, which have been proven to be extremely good for your cardiac health. Your brain well-being is also improved. So the blood flow is improved and the oxygen use is optimized in the entire body. This means that organs like the brain, which uses a lot of oxygen, the most oxygen in the body actually, allows the blood to flow oxygen rich, which has benefits for the entire body. This could give rise to easy rewiring and new neural pathways being formed because the optimal environment is created. It could lead to clear and fast cognitive functioning and memory improvement. So if you have a foggy mind, say goodbye to that. Now, longevity is also one. It may allow stem cells into circulation from out of their protective sheaths or pods for regenerating the cells of the body. Endurance can also be improved. Better blood flow to all the organs are stimulated, which leads to an improved fitness and improved stamina. So, better workouts on the way. Check. What happens during intermittent hypoxia? All the effects of hypoxia are generated through the now well-documented hypoxia-inducible factor 1. These effects are primarily to help you survive in lower oxygen levels. It seems that including hypoxia through breath holding creates a positive stress response by turning your body's survival mode in the way of extreme temperatures from saunas to ice baths. So those extremes really create a lot of resilience in the body. So it increases the red blood cells through the production of EPO and produces a growth factor that leads to development of new blood vessels. This happens even in heart disease, so you can prevent heart failure. It induces nitric oxide synthase, which has a variety of positive effects on the cells and also on the tissues. So nitric oxide helps to protect the cells from oxidative stress and also stimulates vasodilation. It may even help erectile dysfunction as it is involved in the vasodilation that is needed to erect the penis. So it induces tumor protein P53, also known as the genome that protects the DNA of a cell and prevents cells from turning into cancer cells. So, i.e., it may also prevent cancer. Stem cells can only survive in hypoxic environments. Stem cells are abundant in the fetal circulation where oxygen is much lower. They disappear from circulation soon after birth though. Because they survive in various locations called niches in the body, such as the bone marrow in adulthood, the amount of stem cells in the body reduces with age. It is possible that stem cells may migrate from bone marrow to various tissues where they stimulate the repair and the growth of new cells by just a few minutes of hypoxia per day. So this could really benefit a degenerative disorder including Parkinson's and Alzheimer's. It has shown to stimulate neurogenesis in the brain by proliferation of neural stem cells that can also help memory. So your cognitive function and even that, your cognitive function and this intermittent hypoxic training can also act as an antidepressant. So those are a few benefits of what intermittent hypoxic training or this breath work, this pranayama, can offer you.